So 95% of all international travelers from Africa pass through 5 U.S. airports. Detroit is not one of them, so they won't be coming directly into Michigan. But how are the airlines going to now deal with the concerns of those in planes, especially if you have someone that's coughing or sneezing or acting out somehow? How are they going to address this? Well, Ken Jenkins has spent many years in the airline industry, was the former head of the American Airlines Customer Assistance Relief Effort team, the CARE team. He's now a crisis consultant. Ken Jenkins, L.L.C.com is his website. Ken, great having you here.
Hey, thank you for having me.
Yeah, what have the airlines done so far? Have they taken any steps to deal with this?
Well, the airlines have taken steps, and they're actually steps that enhance procedures they already have in place today. They have a concerted education effort with their crew members, cockpit and flight attendants, and frontline employees on the symptoms of Ebola. But they enhance the procedures that they have currently. You had mentioned in the introduction that there were 5 U.S. ports where passengers are being screened, and I think you had mentioned Detroit was now being added to them.
Well, you know what? I don't know if that's the case. I should list this: JFK, Newark, Washington, D.C., O'Hara, and Chicago, and also the Atlanta airport. Those are the 5, yeah.
And that's correct. And what most folks don't know is that airlines already deal with medical issues as well as infectious issues, infectious contagious disease every day. With so many millions of passengers being transported on a yearly basis, there are always going to be medical issues that come up. And as far back as 2005, 2006, when pandemic flu was at that point the really big concern, airlines were vamping up their contagious plans at that point as well.
And so, I mean, what would they do? Because they're still flying people in from West Africa. If there's somebody on the plane they think might be sick, what kind of steps would they take?
Sure. So here's what happens now. Out of Africa, there are exit screenings that are taking place. There's interviews, and then, of course, temperature checks that are going on and things of that nature. And if somebody is on a flight, for example, the nurse that flew on Frontier Airlines, if she had been sick, visibly sick, then the flight attendants within their manuals, and the manuals that they carry are predominantly for medical purposes, and they have a lot of information in there. They take that information on the condition of the passenger and the symptoms to the cockpit. The pilots then contact the dispatch, which then in turn talks to their medical department, and they make a determination based on just a brief interview with the passenger. Where have you been? What countries have you been to? Whether or not they need to divert the plane to one of those 20 CDC control stations, which are throughout the United States, so 20 airports, or have public health meet the aircraft when it arrives at
Incredible.
the
So
station.
if you're a passenger on a flight like this, could you end up being quarantined for a lengthy period of time?
Well, for Ebola, I wouldn't venture to say quarantine, as you could be in a self-imposed or an imposed isolation like several of the passengers from Frontier are right now.
But in that case, they didn't know on the flight. But I mean, if they end up with somebody on a flight that suddenly starts exhibiting symptoms right on the plane, does that put everyone at risk of being quarantined?
It does, but it's also important to note that it's not just for Ebola. It could be for any other type of highly infectious disease that should come through, as we said, pandemic flu. The government has plans with regards to how to keep the supply chain moving in the event of a pandemic, whether it's Ebola, SARS, pandemic flu, or anything else like that.
Do you agree with the decision not to stop flights from Western Africa?
I do. I don't think that it really serves at this point much of a purpose. The folks that are really, really sick, and from what we can gather from the medical officials, the sicker you are in terms of your fever, that's where the heaviest virus is when you're the most contagious. I think what we're finding is the issue right now is that we have protocols that are not being followed. I live in Dallas, and I'm certainly watching the news with the hospital and some of the things that have taken place with the nurses here. It's not so much the illness itself as ill-prepared as the hospital and some of the folks associated with the processes seem to be. And that's really lessened everybody's confidence in how the situation is being handled.
Now, if this becomes a larger issue and we see more cases, do you see it impacting the airline industry, or people just get nervous about flying, period?
I do. I mean, you see that already. I mean, there are already discussions of, people and friends that I know that are like, well, I don't want to fly. Personally, I flew last night on a 4-hour flight. It doesn't bother me, but I understand how Ebola is transmitted, and I'm very cognizant of my surroundings. And I understand everybody being nervous as well. But if this continues, and if Ebola continues to spread, whether it was that disease or something else, you would start to see, I think, a trickle-down effect in terms of the number of flights that are running. Right. And at some point, if a full pandemic started, a real significant shutdown of the transportation system.
Well, that's Ken Jenkins, Aviation Crisis Consultant, online, KenJenkinsLLC.com. Ken, thank you very much.
You're welcome. Thank you, sir.